Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video I'm going to talk about the 3 common struggles that new nurses face. So it can be really difficult transitioning from going from that nursing student to that new nurse, and you can experience a wide variety of feelings. And as a new nurse, this is the things that I experience and that I've seen others really struggle with as well. And the first thing is exhaustion. Here you are, you just got out of nursing school and you know what that entails. It's not easy. And then you take NCLEX and you're here at your first job. So for me, I went nursing school, NCLEX, job. I did not have a vacation or a break because I couldn't really afford one, so I went straight through all that. Then whenever I actually started my first job, we had to go through a nursing residency program, which is literally like nursing school all over again, because we had to do exams, we had to do competency like checkoffs, we had to go to class, we had to learn things, and then on top of that, we had to work. So it was really exhausting, so much, and it was just happening at like lightning speed, and I had to be oriented, learning all these new protocols, learning what my job was going to entail, and I felt really exhausted. So if you are going through this right now, or you will be going through this, just know that it's normal, because you just went through like this life-changing event and you're going to feel that way. But the good news is it does get better, because for me, that first 6 months was like this whirlwind. You had all this going on, graduation, NCLEX, orientation, and then here you are, you're taking the whole patient load all by yourself. You're a real nurse, and it can be really exhausting. But after a while, everything starts really becoming routine. You don't have to take tests anymore. You don't have to go to class. You don't have to stress about all that stuff, and you can just start really enjoying your days off and enjoy being a nurse, going to your job, coming home, and not really having to think about it. So it does get better. The next struggle that new nurses tend to face is anxiety. And as a new nurse, there are a lot of things that you can worry about and have anxiety about. For me, for instance, I would like stress and worry about, am I going to make some crazy medical blunder just because I had lack of experience or I had forgot it from nursing school? I would also worry about, calling up the physician and asking for something really dumb that I shouldn't have asked for, and he or she would be like, "What? Did you seriously ask me for that?" Or not using medical equipment right, hooking something up wrong, or maybe not knowing how to properly use it. I would always worry about that. Along with calling a rapid response and it didn't really need to be called, and everyone walks into the room and they're like, "Why are we here again? What's going on?" So I'd always worry about all those things. So the good news is that it gets better, and that anxiety and that fear that you're having is going to diminish over time, because you're going to be working on this unit, on this floor, day in and day out. You're going to start seeing the same types of patients with the same types of diseases. So you're going to learn those signs and symptoms and what you need to do for that patient. You're going to be seeing the same medications used. You're going to be using the same equipment, working with the same physicians. So you're going to know what they expect, and it's all going to become second nature, and you're going to look back and you're going to say, "Wow, I can't believe I had so much anxiety and fear about this, because it just feels so right and I'm not scared about it anymore." So it dramatically decreases. So if you do find yourself struggling with a lot of fear and anxiety, do not let it conquer you. But remember that some fear and some anxiety is a good thing. It helps keep you on your toes. So to really help you, let's say that you struggle with talking with physicians. You have a lot of fear and anxiety with that. What you want to do is you want to practice this over and over, and have a whole video where you can watch where I give you some tips on how to deal with that, because that was one thing that I struggled with as well. Another thing is, if you don't know how to do something, ask. There's a lot of resources around you of people who can help you. Don't just jump in there and do it and then make an error. And if you do make an error, learn from that mistake, pick yourself back up, and do better next time. And finally, some new nurses feel that nursing is just too hard. I struggled with this as a new nurse, because what happens is that, you go from being a nursing student where you're with a preceptor, and that preceptor is the one who has everything on them, the responsibilities on them. And you are really just there learning and watching and not really having to deal with all that and answer for it. And then you go to becoming that nurse who everything is on you. If that patient's coding, you're the one who has to take action. Your preceptor's not there anymore to help you out. It's you. You've got to give these meds. You got to make sure everything's done before your shift is over. So it can be really intense and really hard when you're first starting out, and it is hard work. But it does get easier over time. And the thing is it really ties back to that fear and anxiety. You really have to just give it time, because at first it's super overwhelming and it's really hard work because you have so much to remember and to learn. But over time, you're going to learn these tips and tricks to help save yourself time. You're going to get faster in your skills. You're going to know what paperwork goes with what, where to find it, who to ask, and it all starts to really just tie together and make sense. And unfortunately, I have seen some new nurses, they're going up that uphill battle, because we all go up that uphill battle, and they quit before that downhill battle's coming. Like literally, they're going up, and if they would have just stayed with it just a little bit longer, they would have noticed that it would have gotten easier, and they could have really stuck with it. So the key is give yourself time, know it's going to get better after you've gained that experience in work. So all these things I have listed, the exhaustion, the fear, the anxiety, feeling inadequate, these are just really signs and symptoms of being a new nurse. I felt them, new nurses I've talked with have experienced them, and you're probably going to experience them as well. But the key is not to let this defeat you. So just remember to give yourself time to grow, time to learn these nursing skills, these protocols, and how to actually be a nurse. And don't quit prematurely, because when you look back a year from now, you're going to see how you progress, how you gain these nursing skills, and how you can actually handle this whole patient load all by yourself, and you're going to be proud of yourself and be glad that you stayed with it. So don't give up and just hang in there. Thank you so much for watching, and don't forget to subscribe to our channel for more videos.